Canadians across the country are dealing with a host of new and unfamiliar anxieties, fears of contracting COVID-19, worries over family and friends who may already be ill, and devastation about losing their jobs and their ability to make ends meet. Now, one of Canada's top mental health organizations is demanding more federal resources to cope with what it's calling an echo pandemic, affecting healthcare workers and other Canadians traumatized by COVID-19. Laura McQuillan on that story for us this morning. Laura, let's talk about what mental health experts are saying, sounding the alarm. What are they saying?
The Canadian Mental Health Association, John, is saying it's already seeing a spike in people reaching out, contacting it, trying to get support. Now, it's calling for more federal resources, and that call came from its chief executive, Margaret Eaton, at the Health Committee at the Commons yesterday, of course, done remotely. Take a listen to what she said.
CBC reported on the surge in demand at CMHA Nova Scotia. They typically receive 25 calls per day, but they're now fielding 700 daily requests for mental health support. And these requests come mostly from people without a history of mental illness.
So you can hear there that spike that they're already seeing in services from 25 calls a day to 700. But of course, people with pre-existing mental health conditions or addiction issues are even more vulnerable right now, and the services they might otherwise access have been suspended. So the Canadian Mental Health Association is calling for more federal investment so those programs, so those organisations can ramp up what is available now and also into the future to deal with what they're warning of, an echo pandemic, a mental health pandemic that would follow the COVID one, John. Now, it's also frontline health workers who are already struggling with mental health because of what they're seeing, working long hours, stressful conditions, a lack of PPE, making them more concerned about their own health. And they might also be isolated from their partners and children at this point because they don't want to get them sick. We're seeing an impact like this. This study of healthcare workers in Chinese hospitals, 50% of them saying they have symptoms of depression, 45% anxiety, 34% saying they're suffering insomnia, and 72% psychological distress. So you can see the impact that's already been reported from countries that were hard hit early on in this pandemic. That's going to flow through to other countries. That's the concern here as well that the Health Committee heard yesterday, John.
This, Laura, as Ottawa has just rolled out some mental health supports. Take us through the details.
That's right. Wellness Together Canada is the name of this new resource, launched yesterday. You can see the website there. I've been through this morning, and what it involves is taking a questionnaire about how you're doing. You'll be asked questions about your mood, the impacts on your life right now, how your work environment, your home environment might be different. And it's looking at things like your stress levels, your risk of anxiety or depression. We heard a bit more about the tools that it will then suggest from the Health Minister, Patty Hajdu.
This resource has different tools available to meet the variety of Canadian needs. Whether it is anxiety, sadness, or substance use, there is something there for you. The options include an online peer community to talk and share and support others. And there are options such as texting, calling, or connecting by video for a session with a professional to address a specific need.
So a lot of resources available through that website, John, and people can access it through canada.ca/coronavirus.
Thanks for this, Laura.